In America, there are currently 123,000 people waiting on the organ transplant list. Of that number, 101,000 people are waiting for a kidney. Only 17,000 people a year actually receive a kidney, and 12 people a day die waiting for one, according to the National Kidney Foundation. Because the number of kidney transplants is so great, it is important to be knowledgeable about why an individual needs a kidney, the transplant list process, and complications after a kidney transplant. Let's start with the function of the kidney and why an individual decide to take the route of a kidney transplant. Kidneys are vital in keeping a balance in your body between electrolytes. If they are not working properly, then treatment is essential in keeping the patient alive. The main role of the kidneys is to filter water and waste so they are able to be excreted from your body. When the kidney is failing, that means at least 80% of your kidney function is gone, and that is not working well enough to sustain life. Diabetes and hypertension, which is high blood pressure, are the two main risk factors for kidney failure. Since kidneys are vital in keeping a balance in the body, when they are failing, all of the other body systems fail as well. Some of the symptoms include heart failure, vomiting, infection, fatigue, swelling of the limbs, and depression. There are various types of treatment for kidney failure, and picking the right option for each individual depends on the symptoms, how much kidney function they have left, nutritional health, and other health factors. There are two main treatments. The first one is dialysis, the second one is kidney transplant. Dialysis helps by removing waste and controlling the blood pressure. It also helps to keep certain electrolytes in balance. However, today I'm going to focus mainly on the kidney transplant. Being placed on the kidney transplant list is a complicated process that is constantly evolving, but I'm going to try to break it down into manageable steps. There are three main steps that must be completed before the individual is placed on the transplant list. From the article, Evolution of Adult Kidney Transplant Candidates, the first step is the patient must complete a risk assessment, which includes a physical exam. The risk assessment looks at things such as age, x-rays, and a review of one's health records. Next, the patient must be free from all infections. They also must get all of their recommended immunizations at least 4 to 6 weeks prior to the transplant to ensure optimal coverage from the immunizations. According to the American Journal of Transplantation, once both of these steps are complete, the patient is then ranked using a point system, which determines their placement on the list. There are numerous categories within the point system, and points may even be broken down into partial points. A few of the categories to receive points from are the amount of time on the waiting list, if the patient needs multiple organ transplants, and if the organ donor herself was a previous donor. Once the patient is on the transplant list and a viable match is found, the transplant will occur. However, the patient is still at risk for various complications. INSEE, OCAN, C, and Tattali stated that despite recent improvements in technology and immunosuppressant agents, there are still complications in about 12 to 20% of the cases. Rejection normally occurs within the first couple months after surgery, but it can happen at any time. However, if caught early enough, in most cases, it's able to be treated and resolved. If the rejection is chronic, that means that it cannot be resolved and the patient may be placed back onto the transplant list, according to Allina Health. Infection is also a common complication. Anti-rejection medications are taken which help your body accept the new organ, but it also lowers your immune response, leaving your body susceptible to infection. Steroids are given to the immune system, but they have serious side effects, such as weight gain, cataracts, and decreased bone density. Infections are typically observed in the first month. Common infections include pneumonia, UTIs, wound infections, and IV line infections. Fungal infections are also common, and they are the most difficult to treat. They often require a prolonged treatment time. Kidney transplants are a life-saving procedure that affects many individuals in the United States. In summary, the number of kidney transplants needed each year is increasing, and it is imperative to be knowledgeable about the process. The kidney transplant process is never easy, but is important to help save lives.